Welcome back to the deep dive. Today, we're taking a close look at something that, well, it can be a real puzzle for dog owners and vets alike. Canine steroid-responsive meningitis-arteritis. You might have heard it called SRMA.
That's right. And we've sifted through quite a few clinical guides, research papers,
Yeah.
all focused on SRMA, really trying to pull out the most crucial information for you.
Yeah, our goal here in this deep dive we've put together specifically for you is to kind of cut through the jargon. We want to get a handle on what this inflammatory condition actually is, who gets it, what it looks like,
Yeah,
how vets figure it out, the treatment, and, importantly, what the outlook generally is for these dogs. It's one of those conditions that definitely sounds scary.
it really does. But the sources we looked at, they offer a lot of clarity, which is good.
Absolutely. And, right off the bat, some things really jumped out from the material, like how incredibly severe the pain often is at the start,
Hmm.
but then how treatment can work almost unbelievably fast, like a dramatic turnaround.
But then the flip side is managing it long term. That's definitely a marathon, not a sprint. It takes real patience.
Okay, let's get into it then. Starting with the basics, just pulling from the sources.
Yeah.
What exactly is canine SRMA?
So fundamentally, the guides describe it as an immune-mediated inflammatory disease. Basically, the dog's immune system gets confused and, well, attacks parts of its own body by mistake.
And with SRMA, the main target is the central nervous system, right?
Exactly. The sources pinpoint the leptomeninges. Those are the delicate membranes covering the brain and spinal cord,
Okay.
and also the small blood vessels, the arteries, within those membranes. That's where the attack happens.
So the body's own defenses are going after the blood vessel walls inside the covering of the brain and spine. That sounds, incredibly serious.
It is serious.
Right.
And that inflammation, that damage to the arteries, it's called fibrinoid arteritis. The sources say that's the main lesion, especially around the spinal cord. Now, why it happens? Well, the thinking is it's just an inappropriate immune response.
Like the immune system overreacting or misidentifying?
Pretty much. And there might be a genetic piece, too. It seems to pop up more often in certain Beagle lines and also Nova Scotia duck-tolling retrievers.
Okay, and a really critical point the source is all stressed. This is not contagious, right? You can't catch it from another dog.
Yes, that's vital for owners to know.
Yeah.
Definitely not contagious. And while, the main event is in the central nervous system, sometimes the inflammation can show up elsewhere, like in the joints, or even occasionally the heart or other body linings, what vets call serosal surfaces.
The guides also mention two forms, acute and chronic.
Right. Acute is that sudden, really severe start we talked about. Chronic can happen if the acute form isn't treated properly or if the dog keeps relapsing, and chronic cases might end up with more lasting neurological issues.
Okay, that gives us the groundwork. So based on the sources, who typically gets this? And what are those signs owners are likely to see first?
Yeah, the profile is, well, pretty consistent, actually. Mostly it's young dogs, think 6 to 18 months old, typically. Though the sources do note a wider range, like from 3 months up to 7 years, or even older sometimes.
And it can be any breed, but some are more prone.
Exactly. Any breed can get it, but yeah, the guides list specific ones. We mentioned Beagles and Tollers, also Boxers, Bernese Mountain Dogs, Weimaraners, Goldens, German short-haired pointers, quite a few. So if you have one of those breeds and a young dog shows certain signs.
Which takes us to the signs themselves, especially for that acute form, which is usually the first thing people notice. And this is where we hit that point about the pain the sources emphasize.
Oh, absolutely. The number one sign, the hallmark, is severe spinal pain.
Yeah.
Often it's worst right in the neck. Vets call it cervical hyperesthesia.
Okay, but what does that actually look like to an owner? How would they know?
Well, it means the dog is just incredibly unwilling to move its head or neck. They might keep their head held really low, maybe cry out if you touch their neck,
Yikes.
or just seem super stiff, really guarding their movements. The pain can be lower down the back, too, not just the neck.
So a dog that was fine yesterday suddenly won't lift its head, seems scared to move.
That's exactly the kind of picture. And alongside that awful pain, a really high fever is super common. The sources mention temperatures getting up to like 107.6 Fahrenheit, which is 42 Celsius.
Whoa, that's a serious fever for a dog.
It really is.
Ah.
Other signs you might see are a stiff, sort of stilted walk, maybe a hunched back because it hurts to straighten up,
Right.
just generally lethargic, depressed, maybe not wanting to eat.
Okay, now here's that other key point the sources really stress, which sounds a bit counterintuitive, but helps vets narrow it down. Despite all this terrible pain and high fever, the actual neurological exam in this acute stage is often normal.
Yes, That's a huge clue.
Yeah.
They might be in agony, obviously reacting to pain, but their nerve function itself, their balance, reflexes, coordination, it's usually okay in the acute phase.
That's interesting. So it helps rule things out.
Precisely. It helps differentiate SRMA from, say, a bad slip disc or a spinal tumor, things that would typically cause obvious weakness or wobbliness, neurological deficits.
Got it. So extreme pain, high fever, stiffness, but they can usually still walk. Okay. That really changes the diagnostic path. So how do vets actually do the detective work to confirm it is SRMA?
Right, so the diagnosis isn't usually from one single thing initially. It's about putting all the pieces together. The dog's age, breed, the signs we just talked about, doing blood tests, and then the really crucial step is analyzing the cerebrospinal fluid, the CSF. And all along, they're ruling out other possibilities.
Okay, so what are those steps generally?
Well, first, a really thorough clinical exam, neurological exam too, focusing on feeling the spine, checking neck movement gently, trying to pinpoint that pain.
And the blood tests, what do they show?
The sources say routine blood work often shows signs of just general body-wide inflammation, like a big jump in white blood cells, especially neutrophils. Those are the first responders for acute inflammation or infection. And the guides also mention some specific markers can be helpful. Things like elevated C-reactive protein, CRP, or IgA levels. These are proteins that shoot up when there's significant inflammation somewhere in the body.
What about pictures, like x-rays or MRIs?
Yeah, spinal x-rays might be done maybe to rule out a bone infection, but they're typically normal in SRMA cases. Advanced imaging like MRI or CT scans, those might come into play, particularly if there are any neurological signs, or just to be thorough.
But do they show the SRMA?
Well, here's the thing the sources emphasize. The main reason for doing an MRI or CT in suspected SRMA is actually to rule out other structural problems, things like a slip disc, a tumor, maybe a different kind of brain inflammation.
Ah, okay.
Often the MRI scan itself looks totally normal with SRMA,
Right.
or maybe just shows some subtle changes. It's not like you see the disease itself clearly on the scan usually.
So imaging is more about making sure it's not something else.
Exactly right. Which brings us to what the sources describe as the most definitive diagnostic test, analyzing the cerebrospinal fluid, CSF.
That's the spinal tap, right? Needs anesthesia.
Yep, done under general anesthesia. And the CSF findings in acute SRMA, they're usually pretty striking. According to the guides, you see a massively elevated cell count, they call it pleocytosis. We're talking hundreds, sometimes even thousands, of inflammatory cells floating in that fluid.
Wow, okay. That's direct evidence of inflammation right there.
Huge evidence. And in acute SRMA, the sources say those cells are overwhelmingly neutrophils again, those acute inflammation fighters. Plus, the protein levels in the CSF are usually high too. Sometimes the fluid itself might look cloudy or even a bit pinkish if there's been some minor bleeding from those inflamed arteries.
Paints a very clear picture of what's happening internally.
It really does. And it's absolutely critical the sources really hammer this home to also test that CSF sample for infection. Run cultures, maybe PCR tests, because the main treatment involves suppressing the immune system.
And you absolutely can't do that if there's an infection.
Exactly. That would be disastrous. So ruling out infection is step one before starting treatment.
The guides also mention tapping joints sometimes, if joint pain is a big feature. It definitely sounds like a thorough process, signs, blood work, imaging mostly to rule things out, and then that definitive CSF analysis. And vets have to consider other things too, right? Like infectious meningitis, discospondylitis.
Yeah, or GME, another immune brain issue, or even just a bad disc problem, IVDD. Lots to rule out.
Which leads us to the big question. Once you have that diagnosis, how do you treat SRMA?
Okay, so this is where the responsive part of steroid-responsive meningitis-arteritis comes in. The absolute mainstay of treatment, according to all the sources, is long-term immunosuppression. And the go-to drugs are corticosteroids, like prednisone or prednisolone.
Starting with a high dose, I imagine, to get that inflammation under control fast.
Precisely. The guides recommend hitting it hard initially with a high immunosuppressive dose, often something like 2 to 4 milligrams per kilogram of body weight per day. And this is where you see that incredibly rapid response we hinted at earlier.
The rewarding part.
Totally. The sources consistently report dramatic clinical improvement, often within just like 1 to 3 days. That awful pain, the high fever that had the dog feeling miserable, it typically just melts away for most dogs, almost like flipping a switch.
Wow, that must be like a miracle to owners after seeing their dog suffer like that. The sources said something like 80 to 100% show a good initial response.
Yeah, that initial turnaround is usually fantastic. But, and this is a huge but, that the source is stress over and over. Just because the dog feels better quickly doesn't mean the condition is cured or that you can stop treatment soon.
Right, this is where the marathon starts, you said.
Exactly. That high dose of steroids has to be tapered down very, very slowly. We're talking over a minimum of 6 to 9 months, often even up to 12 months or potentially longer in some cases. The sources are crystal clear. This slow, controlled taper, managed strictly by the vet, is absolutely critical. You might only decrease the dose slightly every, say, 4 to 8 weeks.
And why so long? Because of the risk of it coming back.
Precisely. Because relapses are common if you taper too fast. The sources cite relapse rates anywhere from 20 to 30% in many studies, maybe even up to 60% reported in some situations, or if treatment wasn't ideal. And these relapses often happen during the taper, or shortly after stopping the steroids completely, often within just a few weeks.
So that amazing initial improvement is really just step one. The long game is preventing it from flaring up again with that super slow taper. And I guess owners need to be prepared for side effects from being on steroids that long?
Oh, absolutely. The guides list the common ones. Increased thirst and urination, polyuria, polydipsia, vets call it. So more accidents in the house potentially. Increased appetite and weight gain, polyphagia. Panting more often. Maybe some muscle wasting over time, skin changes like thinning skin or hair loss. And importantly, a higher risk of infections like UTIs or skin infections because the immune system is suppressed.
Are the side effects usually manageable?
Often they are, but they can be significant. And the sources do mention that maybe around 5% of dogs just don't tolerate the steroids well at those high doses, or they might develop more serious complications. So it needs careful monitoring.
The sources also mention other drugs sometimes, second-line immunosuppressants.
Right, things like azathioprine or cyclosporine. They usually come into the picture if the dog isn't responding well enough just to steroids, or if those steroid side effects are just too severe for the dog or the owner to handle. Adding a second drug might let the vet lower the steroid dose a bit faster or to a lower level eventually.
But those probably have their own side effects and monitoring needs too.
They do, yes. They require careful management and monitoring as well. It's all about finding the right balance for each dog.
The sources also touched on maybe needing some extra pain meds right at the very beginning,
Yeah.
and just supportive care like fluids and nutrition.
Yeah, absolutely. Given how painful it is initially, sometimes additional pain relief is helpful just for those first few days. And making sure they stay hydrated and get nutrition, especially if they weren't eating, is always important.
Okay, so given the severe start, but the good initial response, and then this long treatment road, what's the overall prognosis? What's the long-term outlook according to the information?
Generally speaking, the prognosis is considered fair to good, but that comes with a big asterisk, provided it's treated appropriately and consistently.
And that initial quick response is pretty reliable.
Yes, the sources are quite clear on that. That dramatic improvement early on is common. The main hurdle, really, is managing those potential relapses down the road.
But the good news is relapses can usually be managed.
That's right. The sources suggest that most relapses can be brought back under control, usually by going back up on the medication dose for a bit and then resuming the taper, maybe even more slowly, or sometimes by adding one of those second-line drugs we mentioned.
So big picture then. The information suggests most dogs with SRMA can actually live a pretty normal life.
Yeah, with that prolonged treatment and careful monitoring, most dogs can achieve a good quality of life long-term. Some dogs, especially if they've had multiple relapses, might need to stay on a very low dose of medication lifelong just to keep things quiet.
And the prognosis is maybe less good if cases become chronic or keep relapsing or aren't treated properly from the start.
Exactly. Those cases carry a more guarded prognosis. They might struggle with persistent issues like lingering pain or maybe some neurological deficits that didn't fully resolve. And monitoring is key throughout regular vet checks, blood tests, maybe even repeat CSF taps sometimes to ensure the inflammation is truly gone before making big cuts to the medication. Those markers like CRP and IgA can be useful for tracking progress too.
Okay, let's bring this back to you, the listener. If you encounter this or know someone whose dog is diagnosed, what are the absolute must-know takeaways from these sources?
Well, first, I think just understanding it's the dog's own immune system acting up, it's not infectious. That seems to be a big relief for many owners.
Definitely.
Second point. Second, and this might be the single most critical thing the sources highlight for success, commit to the long-term treatment. That minimum 6 to 9 month plan, sticking rigidly to the vet's slow taper schedule, that is absolutely vital to reduce the risk of relapse. You just can't stop the meds because the dog seems better after a week.
That takes serious dedication from the owner.
It really does. And third, be prepared for those steroid side effects. Know what to look for, how to manage them, and when you need to call your vet if you're worried.
Okay. And fourth?
Fourth, understand that relapses can happen, but they usually can be managed. It's not necessarily a sign of failure, just part of dealing with this particular disease.
Right. So ultimately, the picture the sources paint is that SRMA starts dramatically, often frighteningly, but it responds well initially.
And the long-term success really hinges on that owner commitment to the long, slow treatment plan, working closely with their vet. It involves time, monitoring, cost, yes, but the potential for a good outcome, a normal life for the dog, is definitely there.
Okay, so we've traced the journey of SRMA from that immune system mistake
Through the diagnosis, the dramatic initial treatment response.
and onto that long road of careful management and tapering.
We've seen how the sources describe it. Intense pain, high fever, usually in young dogs.
Diagnosed most clearly with that CSF fluid analysis.
Responding incredibly well, initially, to corticosteroids.
But, and it's a big but, requiring that very long, very slow reduction in medication over many months because the relapse risk is significant.
And with that careful, diligent management, the outlook is generally pretty good.
Right. So here's something to maybe mull over, drawing from what we've discussed from the sources. Isn't it fascinating, that contrast? You have this condition causing such acute, severe signs, the kind that sends owners rushing to the emergency vet. And it responds almost like magic to the initial treatment, signs vanishing in days. It feels like you've beaten it.
Yeah, the relief must be huge.
Exactly. And yet, the actual process of truly managing it, of keeping it from rowing back, isn't quick at all. It's this incredibly long, drawn-out, meticulous process lasting potentially a year or more.
It really highlights the difference between controlling acute symptoms and managing an underlying chronic immune process, doesn't it?
It does. That stark difference between the lightning-fast initial fix and the ultramarathon management needed for long-term success. It really underscores how complex these immune diseases are and why understanding that whole picture from crisis to chronic care is just so vital for helping these dogs thrive.